another entity. We're talking about neural differentiation thing in this chapter. But low power, you may think, why do you show me kind of like well differentiated, infiltrated, invasive squamous cell carcinoma? Because this is how this lesion exactly trick you when you go into this pitfall. In the first piece, really highly suspicious for well differentiated squamous cell carcinoma. We can see really high acanthosis. We also can see this nodule that's like infiltrated into the dermis. However, in another sample, you can see something is different from the usual squamous cell carcinoma. The dermis kind of difference. We can see this sheet solid growth of some of different population compared to the normal dermis. When we zoom in, we can see this cell had really granular cytoplasm. This is another neural differentiation cells called the granular cell. Do not confuse with the granulosa cell in the GYN in the sex stroma chapter. These are the different. This one is granular cell. And then we can see this eosinophilic inclusion. The buzzword is postular ovoid body of myelin. So when you see this population really syncytial growth, that means you could not find where one cell starts and one cell in their cytoplasm just merged together. Syncytial growth with this granular cytoplasm, really homogeneous growth in the dermis. And then you can explain this is PEH, pseudoepitheliomatous hyperplasia. This is not squamous cell carcinoma. This is a reactive pattern to the granulosa cell tumor. But you can imagine if you just have this shape, you will be really easy to diagnose this is squamous cell carcinoma, well differentiated. So always pay attention, even you have limited sample. When you see something not like normal dermis, you need to figure out whether this is granular cell tumor. You can usually the granular cell tumor is positive for S100 and SOX10. However, in the gingival type, you may find both of these markers are negative, and also in the congenital type or non-neural differentiated granular cell tumor, you may find S100 and SOX10 negative. But the H&E feature will still give you the diagnosis of granular cell tumor. And then you can imagine if granular cell tumor happen in the tongue, and then you diagnose well differentiated squamous cell carcinoma, the patient will get a really big surgery, and then it's really dangerous to call well differentiated squamous cell carcinoma in the tongue area. So make sure you pay attention to the dermis. This is another one, granular cell tumor. See, we can see this really reactive pattern of the squamous epithelial called a pseudoepitheliomatous hyperplasia. Always pay attention to the dermis. Yeah, you can find this syncytial growth cell with granular cytoplasm with this eosinophilic inclusion, postular ovoid body of myelin, and then you can diagnose granular cell tumor.